Welcome back. In this lecture, we will locate and identify the structures of the respiratory system found in the head and neck. We refer to those structures collectively as the upper respiratory system. And those structures include the nasal cavity, your sinuses, your pharynx, and your larynx. So here we go. When we think of the respiratory system, we generally think of the act of breathing. The respiratory system does a lot more, however. For example, your respiratory system is responsible for gas exchange between the outside air and your circulating blood. It provides passage to move air from the environment to the lungs. It prevents dehydration of respiratory surfaces by keeping them moist. It protects the body against temperature extremes by, for example, warming the air on a cold winter morning before it reaches the lungs. It also protects against disease-causing pathogens by trapping them in its mucus-covered surface layer. Passage of air through the respiratory system also produces sounds for speaking and singing. And the respiratory system facilitates olfaction or smelling with its receptors in the nasal cavity. Now, your respiratory system is effectively divided into two parts. The lower respiratory system contains your trachea, or windpipe, your bronchi. Now these channels are continuous with your trachea and carry air into your lungs, and of course your lungs. In our present discussion, we will focus, of course, on the upper respiratory system. The upper respiratory system consists of your nasal cavity, including your paranasal sinuses, your pharynx, and your larynx. Now, by the way, some sources include the larynx as part of the lower respiratory system. It's sort of a transition structure between the upper and the lower system. So I'm including it here as part of the upper respiratory system. Now, we will briefly examine the gross anatomy of each of these components. So, your nasal cavity. As you inhale, air enters the respiratory system through the nostrils. Okay, sorry, that's the wrong image. Wrong again. Well, at least I'm getting closer. Okay, there we go. Now, in anatomy, we refer to the nostrils as the external nares. So air enters through the external nares and into this area of the nose called the nasal vestibule. Now, the vestibule is lined with coarse hairs that act to trap large foreign particles, for example dust, and prevent them from further traveling into the respiratory system. The air passes through the vestibule and into the nasal cavity proper, which you see here. The nasal cavity is covered with a layer of tissue whose cells secrete mucus. Now, mucus is a comparatively thick, sticky substance that coats the surface of the tissue. It also lubricates the tissue, and it traps small particles that make it past the nasal hairs. Now, these hills and valleys, if you will, act to increase the surface area of the nasal cavity so that the incoming air has a better chance to make contact with the mucous membrane and thus be cleaned. So the hills here are called conchae, and the valleys are called meatuses. So the word meatus just translates as a passage or passageway. So we can see these structures in real life on this sagittal view of the human cadaver. So once again, to keep you oriented, we see the oral cavity here, the maxilla here, here is your frontal bone, and here is the tip of the nose. And so now we can see the superior concha, the middle concha, and the inferior concha. Likewise, we see the superior meatus, the middle meatus, and the inferior meatus. As the incoming air gets scrubbed in the nasal cavity, it passes into the area of the internal nares. You see that here. Now, a sinus is an air-filled space. The paranasal sinuses are located within bone. Hold that thought. The paranasal sinuses have several purposes, including that of reducing the weight of the skull. The sinuses are lined with mucous membrane, and so they help to humidify the air that you inhale. The sinuses also help to warm the air you breathe. Now, when you inhale, air moves from the nasal cavity into your sinuses. This action gives the air an opportunity to reach body temperature before it moves into the lungs. And so this is especially important, as you might imagine, on a very cold day. Sinuses also give resonance or depth to your voice. Finally, the paranasal sinuses open into the nasal cavity. So the prefix para comes from the Greek and it means next to or beside. So the paranasal sinuses then are next to or beside the nasal cavity. And in fact, your sinuses open into the nasal cavity. So why don't we locate them? Now, as I've said, sinuses are named according to the bones in which you find them. So you're already familiar with the bones. So now you should be able to easily locate their respective sinuses. And so we have the frontal sinus, the maxillary sinus, the ethmoid sinus, and the sphenoid sinus. So in this frontal view of this scary kind of guy, you can see the paired frontal sinus, which is located obviously in the frontal bone. Now, if you happen to get an infection in your frontal sinuses, as the pressure builds, you may experience pain in your forehead just above your eyes. So here you see the maxillary sinus. It's also paired, located in the maxillary bone. And we'll look at these closer in a moment. Here are the ethmoid sinuses, in the ethmoid bone, of course. Now recall back when you were first introduced to the ethmoid bone. Here is the nasal septum. And recall that the ethmoid bone has all of these pockets or open spaces in it. Kind of looks like Swiss cheese. These pockets are the sinuses, and there are many. So we refer to this as the ethmoid labyrinth. And so you see that labyrinth here. And by the way, we do not see the sphenoid sinus in this projection. If we look then at the lateral projection, we're able to see once again the frontal sinus, the maxillary sinus. Here again is the ethmoid labyrinth, and here is the single sphenoid sinus back here. Here we're looking down into the cranium. Can you identify this structure? I hope that you said foramen magnum. So again we see the relative positions in the skull of the frontal sinus here, the ethmoid labyrinth, and the single sphenoid sinus. In this CT scan, you can see the frontal sinus, the ethmoid labyrinth, and the sphenoid sinus. And by the way, here is the area of the oropharynx. Here's a standard dental radiograph. Now, you've seen this before. And you know I like to keep you oriented, so here we have the mandible, of course. The right mandibular condyle is here. We have impacted third molars here and here. The midline is here. And here is the nasal septum. And so you see the external nares there and there. So the rest of the story are the left and right maxillary sinuses. We see them here and here. Here's a more defined image. Beautiful condyle, coronoid process, and mandibular notch here. So we see the very well-defined voids representing the left and right maxillary sinuses, there and there. As an aside, you can see how close the floor of the maxillary sinus is to the roots of the maxillary teeth, and hence the nerves of those teeth. So an infection in the maxillary sinuses can build up pressure and in turn push down on the nerves of those teeth. So a maxillary sinus infection will often manifest clinically as a toothache. Let's talk about the pharynx. The pharynx is this area here, which is shared by the digestive and respiratory systems. Now the pharynx extends from the area of the internal nares to the entrances of the airway and the esophagus. The pharynx has three distinctive areas. We have the nasopharynx, the oropharynx, and the laryngopharynx. Now the nasopharynx, that's the nasal portion of the pharynx, includes the area of the internal nares to just posterior to the soft palate. And here is your soft palate. The oropharynx, that's the oral portion of the pharynx, includes the area between the soft palate and the base of the tongue, this area here. You can see your oropharynx by looking in a mirror and opening your mouth. By the way, this is your uvula that hangs down from your posterior soft palate. The uvula helps keep the oropharynx lubricated. Its tissue also produces saliva, by the way, as well as play a part in some forms of sound production. Now, the laryngopharynx includes the area from the base of the tongue to the entrances of the larynx and esophagus, this area here. And this structure is your larynx, which we will discuss next. So your larynx is located roughly in this area. If we could look just under the skin, we would see this. The larynx here, and this tube is the trachea. Now the larynx is roughly in the shape of a cylinder. It is made of cartilage. Remember, that's one of your connective tissues. It protects the glottis. Now the glottis is the opening to your airway. We'll see that in a moment. The larynx is colloquially known as the voice box because your vocal cords are found here as well. If we extract the airway, it looks like this. And once again, we have the larynx, the trachea, and these are your bronchi, which carry air into your lungs directly. That is obviously lower respiratory system and is not the focus of this course. So let's get back to the larynx and enlarge it here. This is your hyoid bone, by the way. Now, I told you that your larynx is cartilaginous. So there are three major cartilages that form your larynx. The largest of the three is the thyroid cartilage. Here, thyroid means shield-shaped, and you can certainly see how that term applies here. The anterior ridge here is the laryngeal prominence, better known as the Adam's apple. The laryngeal prominence is very prominent, pun intended, especially in men. Here is the thyrohyoid ligament, or the ligament that connects the thyroid cartilage to the hyoid bone. You see how that works? So here's another of the major cartilages making up the larynx, and this is called the cricoid cartilage. So can you name this structure? Yep, that's the cricothyroid ligament. Here are the cartilaginous rings of the trachea. And the third major cartilage of the larynx is the epiglottis here, just peeking over the top. We'll see more of the epiglottis shortly. So if we flip the larynx around and check out the posterior aspect, once again we see the thyrohyoid ligament. Here's the trachea. You'll notice how the cartilaginous rings of the trachea are not complete rings. They are complete, however, in some animals, just not humans. The thyroid cartilage is here, and like the tracheal rings, it is also not complete. Here is your cricoid cartilage, and you'll notice that it is complete. And this is the cartilaginous epiglottis right here. And so your glottis is here. So as you swallow, then, the epiglottis folds down to cover the glottis, thereby preventing food and liquids from entering your airway, and it directs your food and your drink into your esophagus. And remember, your esophagus lies just posterior to your airway. Finally, here's a beautiful laryngoscopic view of the vocal folds, or vocal cords, here and here. And here you see the vocal folds open, and now you're looking down into the glottis there. In the next lecture, we will review the information covered in this section, and that will prepare you for your second quiz. So as always, good luck on the quiz, and I will see you back here for section 4.